Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dominic Cardy, ministre de l'Éducation et du Développement de la Petite Enfance. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Dr. Russell.
Good afternoon, bon après-midi à tous et à toutes. Aujourd'hui, je veux...
Today, I want to speak directly to the youth of New Brunswick. And I want to talk about the vital role you can play to reverse the trend of rising COVID-19 infections in our province. When we talk about COVID-19, we frequently focus on the most vulnerable members of our society, the frail, the elderly, and those with chronic medical conditions. But in recent days, it is New Brunswickers under the age of 30 who are contracting this illness in growing numbers and passing it to others. We are seeing these transmission patterns in Nova Scotia as well.
COVID-19, we frequently focus on the most vulnerable members of our society, the frail, the elderly, and those with chronic medical conditions. But in recent days, it is New Brunswickers under the age of 30 who are contracting this illness in growing numbers and passing it to others. We are seeing a similar pattern of transmission in Nova Scotia and elsewhere in the country. Since the pandemic began in March, people under the age of 30 have comprised only 29.4% of all confirmed COVID-19 cases. But currently, they make up more than half of our active caseload. So 53 of 94 active COVID-19 cases in New Brunswick, or 56.3%, are under the age of 30. Children, teens, and young adults are not immune from this disease, and they can become gravely ill and suffer long-term damage to their health. And they can and do pass this virus to others who are less able to fight its effects. Young people and young families can help stem the spread of COVID-19 infections by wearing a mask when in public, avoiding large gatherings, and reducing your close contacts, meaning the people that you spend time with without wearing a mask. You can break the chain of infections now spreading in our province and help return all regions of New Brunswick into the yellow phase of recovery.
Today, there are 6 new confirmed cases of COVID-19 in New Brunswick. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 4 new cases, 2 individuals under the age of 19, 1 individual aged 20 to 29, and 1 individual aged 30 to 39. In Zone 1, which is Moncton, there are 2 new cases, both individuals aged 20 to 29. There are now 95 active cases of COVID-19 in the province, with no cases currently hospitalized. There will be more cases in the days ahead. We have a record number of people self-isolating across the province following potential exposures, and therefore the risk of further confirmed cases is high.
Today, there are 6 new cases of COVID-19 in New Brunswick. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 4 cases. 2 individuals under the age of 19, 1 individual aged 20 to 29, 1 individual aged 30 to 39. In Zone 1, which is the Moncton region, there are 2 new cases, both individuals aged 20 to 29. There are now 94 active cases of COVID-19 in the province, with no cases currently hospitalized. There will be more cases in the days ahead. We actually have a record number of people self-isolating across the province right now, and therefore the risk of further confirmed cases is very high. The risk that our hospitals may be quickly overwhelmed is also high. We are seeing this in other provinces. Alberta has now moved past Ontario and Quebec as the province with the greatest number of active COVID-19 cases in Canada.
In Manitoba, more deaths from COVID-19 have been recorded in the past week than during the rest of the pandemic.
Hospitals are full of patients being treated for COVID-19. That means that there aren't enough beds and ICU beds and hospital staff to treat other illnesses and provide other healthcare services. We owe a great debt of thanks to those working on the front lines of the pandemic in hospitals and adult residential facilities, in public health offices, schools, and other institutions. I really, truly want to thank everyone in New Brunswick for all we have achieved thus far. We could not have done it without everybody working together. Nurses, doctors, paramedics, teachers, contact tracers, and many others are working tirelessly in high-stress situations to keep everyone safe. Our gratitude for their service and sacrifice is boundless. The best and most effective way we can demonstrate our gratitude is to follow public health guidance every day, no matter where you live in our province. And also be compassionate. It is so important. Compassion for yourself as well as compassion for others. And if you need extra support from a mental health perspective, please tap into our resources. There are many, so please go to the website and look for those resources. You can also call 211 for extra help when it comes to mental health and finances, etc. Wear a mask when you go out in public and maintain 2 meters of physical distance. I think some people feel like they don't have to physically distance if they're wearing a mask. You absolutely do. You have to remember that these measures are most effective when they are done together. Not one single measure works in isolation by itself. They have to be used in combination to have the most protective effect. La façon la plus efficace.
The best and most effective way we can demonstrate our gratitude is to follow public health guidance every day, no matter where you live in our province. Wear a mask when you go out in public and maintain 2 meters of physical distance from others at all times. I will repeat this. Wearing the mask and maintaining 2 meters of physical distance from others, it has to be done together. Remember, these measures are most effective when they are done together. Measures don't work so well when they're done in isolation.
In Zone 1 and Zone 2, which remain at the orange phase of recovery, should wear a mask outdoors as well as indoors. All New Brunswickers can practice effective mask use. When you are arriving back in New Brunswick from Nova Scotia, from the Halifax area, people should self-monitor for symptoms of COVID-19 for the first 14 days. Please get tested if you have symptoms. And you have to behave as if you have come from an orange zone in New Brunswick. Remember to assume that others around you have the virus and act accordingly. Anytime we've seen cases evolve in an outbreak situation in a zone, people were not expecting to be infected. They were not expecting to pass along COVID-19 to their family and friends. But it's happening, and we have to be aware. We can all press the pause button right now and just take stock of where we've come from and what's happening in the rest of the country and in the rest of the world. So again, particularly for young people right now who are getting infected in larger numbers, it's really important. So if you know somebody in that age category, because I know there's only about 13,000 people who watch this every day, and there are 750,000 or more people in this province. So take the time to tweet or send a message on Instagram or Facebook or whatever. Reach out to the people that you know in this age group and help them be as safe as possible at this time. You know, I was young once. We were all young once. I won't say how long ago that was, but it is natural to assume that, you know, you have unlimited immortality. So we feel like we're immune to harm at those ages. But this pandemic is proving how wrong those beliefs are. So again, reach out, engage, educate, involve, help people become part of the solution. I ask all New Brunswickers to watch the updates and whatever information you can share from our website, our webpage. We have social media tweets as well. We want everybody to have the right information to make good decisions. En réduisant le nombre de contacts.
By reducing your close contacts, and again, it means people with whom you're spending time without wearing a mask, by avoiding large gatherings, and by following other public health guidance, you can protect yourselves from COVID-19. And more importantly, you can protect your families, your neighbors, and your friends, your businesses, your schools, your hospitals. Do it for yourselves. but also do it for everyone around you.
Reducing your close contacts, avoiding large gatherings by practicing saying no. I have a friend who has a really good line when she's asked to do something that she's not comfortable doing or can't do for whatever reason. She just says, that doesn't work for me. So have a rehearsed line where if you're uncomfortable and you really don't want to participate in a gathering, or you've changed your mind about hosting a gathering, be comfortable in stating that you can't or you won't in a very practical way. And following other public health guidance, you can protect yourselves from COVID-19. More importantly, you can protect your families, your neighbors, and your friends. Do it for yourselves and do it for everyone around you. We do not want to be engulfed by the second wave. This wave is engulfing the rest of Canada right now and indeed the world. We have managed to succeed thus far, so let's dig deep and do this together, and I know we can get through this. Thank you very much.
Good afternoon, everyone. Bon après-midi et bienvenue tout le monde. I had a couple of people ask why folks take off masks when we do these briefings, partly so folks who are hard of hearing and so on at home can more easily understand what we're saying, and we're making sure we preserve all the public safety and public health guidelines that Dr. Russell and her team have put in place. Le samedi 21 novembre, nous avons été avisés
On Saturday, November 21st, we have been informed of the first confirmed case of COVID-19 in a school following the outbreaks in Zone 1 and 2.
As of last night, we have a total of 7 schools who've been impacted with positive cases of possible exposure across Zones 2 and 3. In addition, 2 childcare centres have been impacted over the last week. I understand the fear and concern that this causes among many families, people who have connections to our school system in particular. But we have reason to be optimistic. Throughout all of our planning, in addition to the experiences that we've already gained through previous outbreaks in Zones 1 and 5 in October, they've allowed us to be able to launch a coordinated response to rapidly evolving situations concerning the pandemic. During that outbreak, we had 13 schools in Zone 5 impacted, positive cases and positive exposures, possible exposures. But by following the plan that we put in place over the summer, and with the cooperation of the public, Zone 5 was able to return to yellow within 4 weeks. In the summer, I was clear. I said there will be more cases and there will be more deaths in New Brunswick as a result of COVID-19. This is not a surprise. We took that time, what now seems like a fairly relaxed period in the summer, to develop a plan developed at a time when we had the luxury of seeing the virus far away from our borders for the most part. Now we're seeing that plan in action, and we're seeing that on first contact with the virus, thanks to the work of the contact tracers and others across the province, and most importantly, the citizens of this province, that we were able to push COVID-19 back. But today, we do have a handful of classes at Hampton Middle School, Lakefield Elementary School in Zone 2, and at Centerville School and Montgomery Street School in Zone 3, who'll be learning from home over the course of the coming week or two. And we'll take advice from public health as we move forward to determine the best time for those students to return. If any families experience any difficulties connecting to remote learning during this time, we do have remote IT services available to assist you. So the Bell Call Center can answer any questions about Office 365, Teams, D2L, or Wi-Fi connections, and their number is 1-833-453-1140.
I am very pleased to see that up until now, we have managed to reduce to a minimum the impacts on students' learning. That being said, the situation is evolving every day, every hour. And this is why we are asking families to remain vigilant and to be on the lookout for any appearing symptoms. If you have any doubts, if you're not sure, you have to go get tested. Over the coming days, I am asking you to continue to stay informed and to be aware of all messages containing information transmitted to you by heads of schools, school districts, or public health authorities.
From the department side, we will keep you up to date with as much information about learning as possible as the situation continues to evolve. And so if you or a close family member has been in close contact with any of these cases, you will be notified by public health for contact tracing. Otherwise, we're committed to protecting the privacy, of course, of our students and staff per the Personal Health Information Privacy and Access Act. So please remember that if you don't hear from public health, no news is good news. School is so incredibly important for the well-being and mental health of our students. So we've been working closely with the districts, with schools, with public health and other partners over the past few months to be as prepared as we possibly could be in the face of a disease that we're all learning about on a day-to-day basis. Unless you've heard from public health, students need to continue going to school. I know this is an incredibly stressful time, but we have not seen any evidence of student-to-student transmission in schools at this point. The guidelines that we put in place back at the beginning of term that many of you wrote to me and said, this seems somewhat excessive. We have no cases in the province. Why do we have these restrictions in place? Those restrictions were put in place in September for today in the zones affected. They were put in place to make sure that in the face of rising number of COVID cases, we didn't see schools subjected to the additional disruption caused by a change in public health and safety protocols. We want to make sure that our students can continue to learn safely despite this pandemic. So our goal has always been to minimize risks and to help support contact tracing for exactly the sort of scenario that we're now experiencing. But let me also be extremely clear that if we see evidence of cases increasing and if public health believes that the triggers that would require a move to a red phase have been met, that this government and myself as Minister for the Department of Education and Early Childhood Development will not hesitate for a moment to make the necessary call to move our schools to online learning, the same way that I did not hesitate to order our schools closed in March when we were facing a disease about which we knew little and for which at that point fear was understandably great. So à l'heure actuelle,
Right now, in accordance with the implementation of our planning and preparation, we have not seen any evidence of student-to-student transmission in school, and it's important to say that again. Our plan to face COVID-19 and the pandemic has been working. We have also managed to contain the outbreaks in schools during the first months of reopening the schools. And we need to continue our efforts and to continue to help one another. We need to stay the course and stick together.
the level of commitment and collaboration across government and the education to help keep classrooms safe and healthy is to be commended. Districts, trade unions, parents, New Brunswickers as a whole have recognized the incredible importance of our education system during this time of disruption and anxiety. So I want to thank all the excellent work that's been put in over the past few days, particularly over the weekend, by the contact tracers and other officials with public health and all the people in the school community who went above and beyond to help public health in their important work. Public health's quick work on testing and contact tracing has enabled us to keep schools open and students learning safely. We need to continue to stay vigilant inside and outside of the classroom. We need to continue to work now more than ever to keep our schools safe. This has been an incredibly strange year filled with new challenges, and it's required us to be flexible, to adjust to quickly changing circumstances. But it's worth as well taking a moment to praise our young people who've responded to these incredible disruptions in their lives with a level of cheerful resilience that I think is an inspiration to all of us. J'encourage chaque personne à continuer.
I would like to encourage everyone to continue to do their part and step up to reduce as much as possible the risks that are in our schools and in our province. Be kind, be compassionate, be patient, and take the time to take care of yourselves and your family. It is important to take care of your mental and physical health.
And I want to remind families that if your child is struggling, a virtual counseling program is available through our schools. A variety of supports and programs are available in schools. And there are other resources available on the Government of New Brunswick's COVID-19 website. We have seen great success to date in battling this pandemic. And that has been because New Brunswickers have listened to the advice from public health. Repeat their message. If you can, stay home. If you can work from home, do that. If there's a social gathering you can skip, skip it. When I get emails from people saying that because the school Christmas social was canceled, that parents are taking it upon themselves to organize those socials outside of school, you are sending your children a dangerous message and possibly risking them becoming the vectors for a deadly disease. We have got to take this virus seriously. If we continue to take it seriously, our hospitals can stay open, our schools can stay open, and we can move towards a world just 100 or so days away now when a vaccine or vaccines start to be rolled out and we can start to put this pandemic behind us. Until that date, listen to the advice from public safety. Listen to the advice from public health, and please continue to wear a mask, practice social distancing, so that in one happy day in the not too distant future now, we can say we don't need to wear masks. We can hug people rather than worrying about how close we are to them again, and we can get on with the important work of building New Brunswick back out of a disease that has changed the world. Merci beaucoup. Et maintenant,
Thank you very much, and now we are happy to take your questions.
oh, sorry. I'm getting in trouble. Sir, Bruce's role here.
Merci, Monsieur le Ministre Cardi et Dr. Jennifer Russell. Thank you, Minister, and Dr. Russell will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, we've heard from New Brunswickers who registered online up to 3 days ago and still haven't been contacted for an appointment by public health to get tested. How is public health working to deal with this delay, and is there a backlog of testing that needs to be done and processed?
Hi, Vicki. So we are working on the backlog, and in terms of what that means, that means that we do have a priority system when we do testing. So when zones go to orange, it changes how many pre-op tests we do, and they have to be prioritized. And anybody that public health refers for testing, they have to be prioritized. And so in terms of the priority cases, those ones are actually getting done. So the rest are going to get done, and we have some information from Horizon in terms of what they're able to provide to address the backlog, so especially in the St. John area. So a second assessment center is being set up on the Rossay Road, and that should be operational tomorrow. And additional capacity has been set up at the Rope Walk Assessment Center and is operational.
Thank you, Doctor. Thank you, Ms. Hogarth. Jean-Philippe Hugues, Radio-Canada.
My question is for Dr. Russell. With the number of cases today, do you have the impression that we are flattening the curve? Are you happy with the results? I'm sorry, I only heard the part of your question where you asked if we were flattening the curve with the current number of cases. I didn't quite hear the second part. Let me repeat. Are you pleased? How do you feel with these new results? We had 23 cases last week, today much less. Do you feel that we are flattening the curve? I'm always happy when numbers are lower than they were. It means that we're going in the right direction. But right now, there are about 1,000 people isolating at home for 14 days. I would be very, very happy if after 14 days, the curve is completely flattened and the zones that are in the orange phase can go back to the yellow phase.
Natalie Sturgeon, Telegraph Journal.
Thank
Thanks, Bruce. My question is for Dr. Russell. Today, the mayor of St. John, John Darling, spoke about the growing support for a lockdown under the red phase in Zone 2, including several businesses in the uptown where the majority of these public exposures exist, to protect people and keep their staff safe. Why does public health place the onus on small business to protect the public instead of implementing a 2-week lockdown under the red phase?
So when we had our outbreaks in the north of the province and also in the Moncton zone previously, we felt like we were able to very successfully manage the outbreaks in the orange phase. Obviously, there are many things to consider when we implement any protocols or measures. They are based on epidemiological indicators, public health indicators, as well as hospitalization and hospital resource indicators. So that is what we do, that is what we base our risk assessments on when we make a decision to go to a different phase. So because we were able to successfully manage those outbreaks in the orange phase, we know that if we can do that successfully like we have, then we are protecting the social determinants of health. We are protecting education. We're protecting people's incomes. We're protecting people's mental health, et cetera. So I understand the worry and concern, but again, we will do everything in our power to manage the outbreaks in the orange phase. But we are evaluating this situation every single day. It's a very fluid situation, and we are working with all of our partners with respect to Horizon, Vitalite, public health, and all of government in terms of the departments that are implicated. So make no mistake, if we meet the indicators in terms of having to go to the red phase, we certainly will. But it is a last resort in terms of, based on our indicators, we really want to exhaust the other phases in terms of our response to be able to successfully manage outbreaks in the orange phase, again, so that we have that balance between protecting the social determinants of health as well as protecting people from COVID-19 and overwhelming the healthcare system.
Thank you, Doctor. Thank you, Ms. Sturgeon. Savannah, Telegraph Journal.
Hi there. You spoke earlier to the risk of overwhelming our hospital system. I know you guys have put out modeling for projections before on how certain numbers of cases will impact our system. Do you plan on releasing similar modeling, just given that we're having kind of a resurgence at this point?
Well, in the outbreak in Zone 5 previously, and the other outbreak in Zone 1, we did have a different demographic that was involved in terms of what we were projecting for hospitalizations, et cetera. Because in these particular outbreaks currently, the age group is younger, so it is a different type of projection. I don't know if they have those calculations, if they would be made available, but certainly, again, they look at their hospital capacity currently as it stands right now. What the orange level of response does to the backlog of other services. But the other thing that we look at, again, is hospital resources from a staff perspective. So these are all the things that we take into account. It's not just the modeling of how many hospital beds, but it also includes human resources and the ability to provide healthcare services.
Thank you,
There's
Ms.
no plan to
Thank
share
you.
that publicly? Sorry, there's no plan to share that publicly?
Oh, the triggers are online that include the hospital indicators.
The modeling, though, the modeling.
I don't
numbers of cases and the hospital system. Is there a plan to share that publicly?
I don't know if they've actually done modeling in this particular case. All I know is that they are looking at hospital capacity from the bed and ICU capacity, but also from their human resource capacity in terms of how many people are self-isolating and what services are impacted currently.
Laura Brown, CTV.
Hi there. I'm wondering if, because Nova Scotia has moved to mass testing for asymptomatic people, and Campbellton, we did mass testing in that area. I'm wondering if you're considering that in the St. John's area, and if not, why?
Hi, Laura. We did that up north a couple of times, actually. But that, again, very different type of outbreak. That had many, many different settings of exposure in terms of the community, the way that the transmission was happening. And I don't think we're at the point where we want to do any kind of mass testing at this point, for the simple reason because all of the cases in the St. John zone are all linked. So there is no unlinked chains of community transmission that we're seeing the way we saw up in the Zone 5 outbreak. So I hear what you're saying in terms of, yes, we did mass testing, but the reasoning behind it was because we had those unlinked chains of community transmission, which we do not see in the St. John zone in that outbreak. Every single case is linked.
Thank you, Ms. Brown. Thank you, Dr. Sébastien Lechance, l'Acadie Nouvelle.
Hi, my question is for Mr. Cardy. Since the start of the pandemic, in-class teaching has been done very differently. I wanted to ask Mr. Cardy the following question. Has the fact that we have managed to put in place some form of remote learning, let's say during snow days or technical problems where schools have to close, do you think that these systems of remote learning could be used in those situations to help students learning? Thank you for your question. You're talking about snow days. That is protected by the collective agreement, so it will be part of the bargaining with teachers in the future. But I want to say that the reason why so many of our teachers are energetic in their defense of snow days is because of the amount of work that they've had to do in the past year, and it was unpredictable, really. And sometimes they see snow days as a day to catch up on work, to do class planning, to do report cards. So we will discuss this opportunity, but for this winter, we will continue as usual. Of course, this transition to remote learning offers us solutions to address climate-related problems.
Snow days are covered under the collective agreement, so we don't see any likelihood of change this winter, but I want to underline the reasons why so many teachers defend snow days is because it's one of the few days they have to catch up on work, and the amount of work that teachers are expected to do on a routine basis has been vastly increased without any real recognition over the last number of years. And those are both things, snow days and that amount of work done without, expected to be done without the time to do it, are both things that I'm sure will be addressed in the coming collective bargaining process with the teachers' unions. Merci.
Thank you. Isabelle Legier, CBC.
Hi, my question is for Mr. Cardy. In light of the fact that you dedicated much of your address today to addressing youth and young adults, are you concerned that some people employed by the Department of Education may not be following the orange phase rules during their off hours at restaurants or bars, for example? And if so, what are you doing about it?
Well, I am not the Minister for Public Safety, and I have no responsibility for what staff do when they're not working. However, I can tell them that they better shape up. That if I find out anyone in my department has been breaking the rules and not following the requirements imposed by the orange phase, then I would certainly expect them to be ready to take the consequences of breaking the rules that are there to protect all of us. J'espère que c'est assez clair que si j'entends qu'il y a les...
I want to make it very clear that if I hear of any Department of Education and Early Childhood Development staff that is breaking the rules in the orange phase, they have to be ready to face the consequences of their actions. We need to follow the rules that have been put in place, only maybe for the next 100 days, but please, for the months to come, follow the rules.
Thank you, Minister. Timothy Jakes, Campbellton Tribune.
Yes, question for the Minister. Paragraph 10C of the November 20th emergency order says that residents of Listigouche First Nation and of Pointe-à-la-Croix, Quebec, who are pre-registered and been approved can enter New Brunswick to attend school. There's nothing in there that makes us contingent on anything the Quebec government does or doesn't do. So why is this exemption not being followed in the case of high school students, although I understand it is for K-8 students?
Thanks for the question. We left that exemption in place so that if the government of Quebec starts to see reason and starts to do the right thing, that we can allow students from Liste Gauche back into our schools tomorrow without having to wait for a renewal of the order that usually takes place only every 2 weeks. So that's the reason for it staying in there. The emergency order is not the only government that dictates the policies of the government of New Brunswick. We make decisions in addition and on top of that. So I've been very clear. We welcome the students from Liste Gauche back the moment the government of Quebec restores the checkpoint at Pointe-à-la-Croix to protect New Brunswick from COVID-19. We are seeing the impacts of rising case numbers around our region and around the world. We do not want more of those cases here in New Brunswick. That's where the virus comes from. It comes from outside. We had 0 cases a few weeks ago. So we keep it out by following the rules. Vraiment, en français, on va absolument laisser.
We will absolutely let Liste Gauche students go back to school as soon as the Quebec government is ready to put back in place a control at Pointe-à-la-Croix to protect the province of New Brunswick. We are seeing that cases are coming from outside of the province, and the only way to protect us is to restrict access to the province. It's not a perfect system. I'm so sad we have to do this right now, but the government of Quebec needs to take its responsibility. Education is 100% a provincial responsibility. We are ready. We're just waiting on the government of Quebec. Reese Sutherland, CBC.
Hi, good afternoon. Question for Dr. Russell. We keep hearing about confusion around the messaging. The Premier himself admitted this yesterday around things like when to wear masks, around bars being allowed to stay open, but individuals have to limit their activities. So given your stated concern for the growing numbers of cases among youth and young adults, I'm wondering, will you be clarifying your messaging in any way, and will you be trying other channels or methods to reach this audience?
So we know that that messaging is specific to that group, that age group, and they do have different methods that communications is working on to reach that target audience. So there are many, many different ways of doing that with respect to social media, et cetera. So that is happening. With respect to, you had a question about masks and whether or not people had to socially distance as well as wearing masks, or, I'm sorry, I didn't hear that part of the question.
I was just sort of basically setting up the general confusion around a number of aspects of the messaging and the rules. So I was wondering if there were some changes coming to this messaging, maybe some clarifying and tightening up.
With respect to masks and when to wear, because I know there has been confusion about wearing masks outdoor in public spaces in the orange phase. So wearing masks indoors in public spaces in the yellow phase everywhere. And then if you're in an orange phase, then you need to wear masks outdoors at all times in public spaces. Does that help? And there will be more clarifying message about that, but that is the message.
Okay, thank you.
John Chillibeck, Daily Gleaner.
Yes, hi. Thanks for taking my question. Earlier, I believe when there was an outbreak in the Campbellton region, I had asked this question. I was wondering if it had changed at all. The businesses outside of the zones in orange, for instance, Fredericton, some businesses are now asking patrons if they're from those areas and asking them not to come if they are. Is this something that you recommend or you would dissuade businesses from doing?
I think in the healthcare system, it's really important that people be screened and have those questions asked. But outside the healthcare system, technically speaking, people who are traveling for essential reasons should be allowed to participate. Obviously, if they're coming from an orange zone, they have to wear their masks outdoors in public spaces as well as indoors in public spaces. So at this time, we're discouraging any non-essential travel outside of the orange zones. So, and anybody who's traveling for essential reasons, for instance, for healthcare services, they would be screened appropriately, again, based on the fact that they're coming from an orange zone. But there shouldn't be really questioning about that if people are following the guidelines of not traveling for non-essential reasons.
Thank you. Jordan Gill, CBC.
Yes, my question for the minister. With cases increasing at schools, are more parents keeping their children home from schools as a precaution? And are more teachers also requesting to teach from home? And at what point does this tip over into making more sense to close schools?
Thanks for the question. Certainly hearing from parents saying they're intending on keeping their kids home, and some teachers who are concerned. it's a moment to give a real shout out to the teachers and the other staff, the EAs, who are continuing to go to work and continue to go to work in Campbellton and Moncton and other places that have already been touched by COVID-19. So certainly some are making that choice. Many don't have that choice. Many parents are vulnerable economically themselves, may have jobs that don't allow them to easily take time off, don't have the ability to quickly and easily arrange childcare, a myriad of other reasons why staying in school is so important. The mental health impacts of being out of school, we've seen the reports of this arising around the world. So our goal is to keep our schools open as much as we possibly can based on the triggers that were established. The color phases are government creations based on trying to provide clear indications to the public, which sometimes, as Dr. Russell was saying, can get confused because, of course, they have to be changed and updated as the science and the information changes and is updated. But our goal is to continue to keep our schools open and safe as long as we can. And at this point, we are seeing no reason to close our schools. I know this creates stress for parents, and I can't imagine for those of you who have kids in the system, working in the system, the emotions that this must bring out. And we don't take these decisions lightly. There's no effort here to try and play with the lives or safety of any New Brunswicker. We're trying to make sure that we keep an incredibly important institution that has a lifelong impact on our young people open and accessible as long as we possibly can. Alors pour tous les parents, pour tous les membres de l'équipe.
For all parents and for all staff members in schools, we understand how stressful this situation is. We will continue to do everything we can to keep our schools open and safe. We know the damages that closing schools can make, and so we will do everything in our power to protect our schools, to protect our hospitals. This is how we'll survive this pandemic.
Mr. Minister, Meg Cunningham, CHMA, Sackville.
Thank you. My question is for Dr. Russell. You mentioned in the last Campbellton outbreak that there were several unlinked chains of transmission for many weeks. To give us a sense of what we're looking at here, how many unlinked chains of transmission are there in Zone 1 and Zone 2 right now, and how long are these chains of transmission?
So in the Zone 5 outbreak that included Dalhousie, Campbellton, and Balmoral, there were about 5 unlinked chains of transmission at one point, but by the end of the outbreak, we were actually able to link them all. It just took a really long time to re-interview people and find those links. But at the time, because we didn't have those links, we were assuming that there was community transmission at that point. Thankfully, we were able to get that outbreak under control and succeed, and that was a great success. But now in the St. John zone, which is Zone 2, there are no unlinked chains of transmission. Every single case in St. John is linked. In Zone 1, in the Moncton zone, there are a couple of unlinked chains. I actually don't know how many cases are involved in each of the clusters. But again, contact tracing and interviewing is still ongoing, so that's why we haven't declared community transmission. Again, because of our lessons learned from the Zone 5 outbreak, that we can take a while. It can take a while before we can establish the links, but we are definitely still looking for them.
Thank you, Ms. Cunningham. Thank you, Dr. Tom Bateman, Times and Transcript.
Oh, hi there. I'm worried that, can you hear me?
Hang on one sec, folks.
That is not me.
Everybody, please mute your microphones. Tom Bateman.
Good. Hi, this question is probably best put to Premier Higgs, so perhaps Mr. Tardy can speak on behalf of the government. I talked to a business owner who was told by WorkSafe New Brunswick it would take as long as 15 days to have a specialized technician entry into the province from Quebec cleared by the agency. He says this is unrealistic, especially in circumstances where a business may not be able to operate without an intervention from that out-of-province worker. And he says this is especially the case because bringing such a worker into PEI or Nova Scotia would only take a matter of hours. So where do issues like this rank on your government's priority list? And are you aware of a reason why this province's approval process appears to involve, more red tape than our neighbors? Thanks.
So you sort of hinted as to my likely answer to your question and your lead into it, which is I'm not Premier Higgs. And despite the many wicked smart people who work for me in the Department of Education and Early Childhood Development, I am unable to answer your question because it is not part of my portfolio and nothing that I have any knowledge to speak on. So I figured that in that case, saying less is probably saying more. Je n'ai pas vraiment la base sur répondre à ces questions, c'est hors de mon...
I don't really have the knowledge as Minister for Education and Early Childhood Development to answer your questions, so that is pretty much all I can say. I will ask the Premier for information. Simon Delac, l'Acadie Nouvelle. Hello, my question is for Dr. Russell. At the start of today's press conference, you've talked about young people. Are you worried about specific behaviors, maybe specific gatherings? You talked about a super spreader event last week. Are you maybe worried about younger people relating to that event? Inaudible comment. So what we would like for everyone, regardless of their age, to do is to wear a mask inside and outside if you're in the orange zone. If you're in the yellow zone, is to always wear a mask inside, to not attend gatherings, attend social meetings, basically to not really go to any gathering with anyone who's not in your one household bubble. The exception is if you live alone, in which case you can get support from another person or one household bubble. I think that for everyone in all ages, you need to think about the possibility of being infected and infecting someone else. It is always present in our province, regardless of where you're living. It is always a possibility, and we want everyone to adopt behaviors that will protect you before the first case is in your community, because once there's a case in your community, it's a little bit too late. You might already be a close contact. When you take your mask off indoors with your friends, your partner, your family, your anyone really, those are close contacts. We want you to limit as much as you can the number of close contacts you have. This is how we will manage to flatten the curve. So behaviors are staying 6 feet away from others, wearing the mask, washing your hands, to not participate in gatherings, not go to parties, and to keep a very low number of close contacts.
See Dr. Russell. Alan Deering, 91.9, The Bend.
Thank you, Bruce. Question for Dr. Russell. Doctor, under modifications to the orange level, we are now restricted to single household bubbles. Has there been any consideration placed on people who live alone? There are so many single people out there. There's so many people that live alone. I mean, they're basically in self-isolation here, even though they're not in self-isolation, if you know what I mean. So is there any chance that we could perhaps modify the single household bubble? And by the way, I'm asking for a friend.
Yes, absolutely. Listen, the intent of the single household bubble really has been around protecting people who live alone and protecting their mental health. So the wording is being changed to clarify that. I'm so sorry that it hasn't been clear. I'm so sorry for any confusion because again, from a social determinant of health perspective, we know that when we manage COVID-19, we can't ignore all the other components of people's health and well-being. So absolutely. So the new wording that we will have for the single household bubble, which I apologize that we didn't do this from the beginning, but it certainly was the intent. Your single household bubble can be extended to a caregiver, an immediate family member who requires support, including mental, social, and emotional support. If you live alone and need mental health or other care support, a caregiver can be a formal or informal caregiver, such as a close friend or neighbor. It is only the same single household permitted to go to restaurants and other venues, including church, together. So absolutely, great question, and I'm so grateful that we had the opportunity to clarify today because it has been on my mind. I do know there was confusion around that, and certainly the intent has always been for no one to ever have to be isolated alone. Again, from a social determinants of health perspective, we know that it's so important for people who live alone to have that kind of support.
Thank you, Mr. Deering. Tim Roselle, Global TV.
Hi there, this question is for Dr. Russell. Just going back to the beginning of the Q&A portion here, it was mentioned about the backlog of testing and test results, especially in the St. John region. Can you expand on just how much of a delay we're seeing in what has normally or had recently been about a 48-hour wait? What kind of delays are we seeing right now?
So we were seeing an increased volume, as I mentioned earlier. So there's a couple of different things contributing to the issue. One is when zones go into the orange phase, they have to do more pre-op testing than previously. So that was adding to the surge in terms of the number of tests. 811 calls went up. We prioritized all the people that were symptomatic and close contacts or directed by public health to be tested. And then anybody else who had symptoms but was not part of that pool of people that public health was actually investigating, those are the people that would have had to wait a bit longer. Now, our goal is always to make sure that from the time that you get tested to the time that you get results would be 24 to 48 hours, and can be up to 72. And certainly the most important people to notify, again, from a risk perspective in terms of contact tracing and transmission of virus, are the people who are positive. So right now, to address the capacity issues, et cetera, what we're doing is we're going to have additional capacity set up at the Rope Walk Assessment Center. That's operational right now. We have a second assessment center that's being set up on Rossay Road, and that should be operational tomorrow. So we are aware of these delays. We're working really hard with our partners to get those things up and running as quickly as possible to, again, address that backlog. But just to be clear, that the prioritization has been there since the outset, and again, Horizon and the lab and everyone has been quite responsive in terms of making sure that the priority tests have been done in a timely way.
Okay, thank you.
Thank you, Tim. That concludes today's update. Voilà la fin de notre mise à jour pour la journée. Merci beaucoup. Thank you, everyone.